I'm Janice. Yes, I'm from the the trauma nurse coordinator, the trauma nurse consultant in Queen's Margaret Hospital now, and my talk will be on. Let me share the screen. My talk will be on the topic is how should we train our trauma nurse for the future. So we learn a lot from Dr. Chen Jizhong on the how our emergency nurse will be trained and different level, and they are very well structured. Okay, in different levels. However, for the trauma nurse, okay, we seems this part area do not have a very well structured yet. Okay, so let's share what we have and what should we go further. So just a moment. So my talk will outline on what the trauma nurse should be equipped and what are the current availability of trauma trainings for the nurses and what are the limitations of the current training and what should we do to improve it. Okay, so here is this one showing us the Jeff's model of trauma care. The trauma patient actually the trauma that we provide is not only start from emergency medicine, emergency department. It starts before the injury. So if we can prevent from injury, so the patient will not be injured. Okay, so all the things can be minimized, the pain and the medical burden, whatever. So the most important one part is injury prevention, and also the second part is the pre-hospital care. So we later on we also got we share the aeromedical setting and the fire nurse, whatever. So actually, the nursing care, we start from pre-hospital phase, working together with fire service department, ambulance man, ambulance crew. And then the care in pre-hospital is very important. It's part of the trauma care because if they treat well, some necessary treatment was given, they're well protected before they come to the hospital, or they be transferred very quickly to the hospital. It also helps our trauma patients. So the nurses also play a role in pre-hospital care on what patients should be go to the hospital, what should be sent to the nearest hospital, and how working closely with the ambulance crew. The third part is the main chunk of the trauma care for by the nurses is inpatient trauma care, to which we cut that the patient arrive ED department, operation theater, ICU, and then ward, and then finally go to rehab. Okay, so this is cycle is more the service model of trauma care, and nurses play roles on each aspect of these models. So what is a trauma nurse? Actually, now if we have the very broad concept is the nurse working for trauma patients. Okay, so they can be working on emergency medicine, and emergency department, and ICU, the surgery, and operation theater and orthopedic surgery, and actually also some radiological departments. Okay. And so they're very wide spectrum from the different departments in the hospital. So and the nurse not only need to involve in the basic care, which is, and as Dr. Chen say, it's very important that we provide excellent bedside care for our patients. And so we also need to have some program and the system, and also facilitate the multidisciplinary team action and coordinate it. Okay. At the same time, we also provide education both to patient, relative, and our junior nurses. So the role of nurses actually is multiple roles, okay, and also a different aspect. As I mentioned before, it starts from, and then we also need to be proactive to look at what patient wanted to. Okay, I always think that as a nurse, no matter which specialty, you always need to tell yourself you are the patient's advocate. So especially the patient, they cannot talk. They cannot ask for anything, as they are the role child. As they don't know what do they need, okay, and what treatment they have, okay. So that all need by the nurses to help them to voice out. We need to identify what the problem is, both the patient and the system and the current patterns, okay, and then try to enhance it by better injury planning, and also to learn also from the international standard, what can apply in our situations. And further, we also have some CQR project and some try to influence the healthcare policy and injury prevention program. It's all work together to help the trauma patients. So the role is so big and so many. And how can we change? And what should we equip our staff on the nursing? Okay. So as we know, all we are adults, because most of them graduate from nursing school, from university, and they already are adult. Adult learning is a bit different to the primary or the secondary. They need to be self-motivated, and they need to be self-directed to look at what do they interested, what they need to learn, and what they already know, what they need to equip themselves. So we need to motivate them and transforming and also transfer this information in the clinical practice. And also they need to have awareness to learn. They can't think that I'm good enough, so proud of myself, okay, I'm a nurse, that I'm like the queen, which is not the truth, because the more you learn, the more you know you are insufficient, okay? So we need to, what we use is to apply the theory of adult learning. We need to motivate the internal motivation, to motivate to learn more, to help the patient more, okay, by intrinsic motivation as well. So for what as educational activity we can apply to train our nurse, as I think everyone knows this, okay, so actually they can learn from journal, they can learn from training, they can learn from like the courses, like try to become a fellow or PRCC courses. There are lots of things. Also, they can learn from the trauma grant one, the clinical practice, the trauma audit meetings. So there's lots of different methods and opportunity assisting daily. But for the learning, there's different path or level for the nurses. So in the very beginning, the registered nurse may be very different. They need to learn basic skill and the knowledge and clinical practice. When they are level 2, the ANE, APN, or even now we have an ANC, associate ANC, and O, okay, they may need no more advanced skill. They need to be in leadership role. They need to help the people for training and also promote better health, and also some CQR project. And further, there's the NC on trauma. So each trauma center has the trauma NC. And this is not the end of the career, okay, but also can further up to be the leadership and to be the nursing leaders. So we got different type of nurse. Maybe the training and education may be a bit different. So we look at the, we have in the among the trauma nurse working group. So we have draw these 4 levels, okay. I mean, just brainstorming and thinking about what do we have and what do we need, okay. For a basic one, we need to, maybe the new grads, we need to know so that they know how to use the equipments, sections, logos, level 1s, and all these basic skills, they need to be equipped because they not always be seen. Trauma patient can come, but as Hong Kong actually is quite a civilized society, not every day like the big trauma center in America and Australia, they got lots of trauma patients sent to the trauma center. Because we got 5 trauma centers, so the trauma case was diluted. It means that our experience also diluted. So we need the training for them to keep all the skill on how to use this equipment when the patient comes to the ED department. And next one is a specialized trauma nursing course. As Dr. Chen Zizong mentioned, we got the TNCC, the ATCN, and also the TCA. TCA is a bit the trauma care after resuscitation. And also some clinical experience sharing with different specialty. Because the trauma is multidisciplinary, so we need to know the care and some specific points about the trauma patients. And also go to PRCC level. I mean, the PRCC for emergent, that we got very good, that we got different type of PRCC. They all cover the trauma as one of the elements, okay? So to be advanced level, we need to have a PRCC in the trauma-related specialties, okay? And this time, they may need to lead to some evidence-based project to enhance a better care for patients. And last level, maybe the trauma nurse coordinator. We need to do the AS coding, the topics, and also the audits, injury prevention, and trauma registry, and at least the trauma master levels. So because the 3 level was covered, and then we are very familiar. So I will focus a bit more on the higher level on trauma nurse coordinator and trauma nurse NCs. And what I mean is the futures, okay? Because in the future, everyone can be as NC and can be a higher level, can provide care. So for nurse consultant, we need to have these 5 domains. Everyone well known in service development, expert practice, evidence practice, and based research, the knowledge transfer, and also quality improvements. So we got different types of training to enhance our trauma nursing care and equip our trauma nurses. This is a picture taken with the Wilson's trauma team training. Because as I say, the trauma team trauma care involve multidisciplinary, okay, so, and different peoples, okay. So in this picture, you can see involved all different personnel, they participate in trauma care, including doctors from orthopedic surgery, ICU, A&E, radiologists, and A&Es also, okay, PDICU, the nurses in A&E and nurses in other ward as well. So we mix together because interaction among each other can be by these trainings, okay, can learn from each other and know how to work with a team. So that it would be good to use simulation trauma team trainings, okay? So we pretend that there's a patient, what to do, and get different topic and main focus on each trauma team trainings. So I share one of the recent trauma team training for you. This is conducted on June 21, okay, June 10 last year, and this is on pediatric trainings. So the first things we will invite the speakers, okay, to have MCQ set that on the Zoom, so they can go to the Zoom, the online lectures. Not only the participants, but everyone interested can log in the link and have study the lecture and also answer the question MCQ. So they think, not just go through without just like the water on table. So they can think of what do they learn is correct or not. So but the MCQ is very good to capture what they learned. And after this, we go for this is the MCQ and the participants. And then we also prepare the mannequins, okay, according to different types of injury. Like this one, we go into ECI or blunt trauma or pediatric trauma patients. And then we have debriefing to tell what do we there's a team from different aspects, different hospital, and also different specialty with doctors and nurses. So after debriefing, we got the trainings. So we hands-on training and just do it like actually happen. So the team actions, the knowledge applied, then all will give you a challenge. Okay, so what do I know in the real practice? And so this is the facilitator will look at that, and then just like all other short team trainings, at the end we have very good debriefing. Actually, if you think about debriefing, it's quite boring, people sitting together, but reality is not. Okay, you can see from the evaluation, they feel debriefing is very useful because some concept can be clarified during the practice. And when you're doing the things, you got something, why I don't know this, okay, what should I do is better. If you really hands-on, then you stimulate you to think, okay. So they feel they feel most of the contents are useful and to them. And then they find that this method is also good both by the online training and the hands-on questions, okay, hands-on trainings. So this is one of the methods to train our nurses. And then I know that now actually we also got some different similar training on the provided to the trauma team training included in that, like QE also won the courses, and the individual trauma center also won these trauma team trainings. So this is one of the methods how to train our trauma nurse. And also the nurses is not only just like doing every day as by order as what we actually need to think about what is a better for our patient. We always know what can we build a better system to enhance patients' outcome in terms of the quality of life, the physical outcome, and the survival ways. Okay. So so the nurses need to think of. We also for the trauma nurse, okay, or trauma nurse coordinator or ANC, they need to manage and develop the trauma registry. The trauma registry got different aspects of the patient journeys. And everything was included from P-hospital, as I say, the whole measurement, from P-hospital, emergency care, inpatient care, operation theater, and then also some demographic data of the patients, and also the outcomes. So actually, we look at the system, any problem, like say if the delay OT, then we need to think about how can we enhance more quickly access to definite care, how any hurdles, any barriers for we to get access to the operation theater. So this is a trauma nurses to think about, not only just how can I prepare the operation for the patient. But also, if you find the checking of the patient got a problem, whatever hurdles, we need to think, and then we need to correct it, okay? And to think of, as I say, to build a better trauma system for our patients. So the trauma registry can, at the moment, can look at all the aspects from the CMS and give us a pictures of the whole patient journeys. And then for the nurse, one of the trauma nurse's responsibility is need to do the coding, use the periodic injury scale, okay? What this book is actually a patient, the coding according to different injuries, okay? And use also the IS score, the AIS score, and also the revised trauma score to calculate the patient's predicting survival rate or mortalities, okay? And we compare to our actual performance and know our system doing well or not. So trauma nurses all take up this role for manage the trauma registry, data collection, and also doing the report and give the audits about what case, okay, is had a problem. Other than the trauma, and other than this trauma registry, we also need to change, okay, think about how can we conduct the injury prevention program. So the nurses need to have an idea, what's the problem in your community? And then you think about what can we do to prevent it happens, okay, for injury prevention. Let's say what we do, like in the new territories, maybe injury, bicycle injury. However, in currents, the leading trauma causes, the mode of injury is low fall from elderly. So we again need to think about what can we do, how can we advise our public to prevent injury from fall. Another thing is that we also need to develop the clinical protocol and research. We're not just told what we need to do, but we need to think about what can we do it better, in a better way. So we need think about, we need to train the nurses to look about the quality improvement program. They need to identify the problem and conduct the injury prevention programs. And actually you can share the results, not just put in a shelf or put in somewhere, no one knows that. We need to apply it in the practice to improve the patient care. That's the most important, patient care. So as I just mentioned before, we need to apply the problem. And then like this one, the most one we did is quite good, is like say the massive blood transfusion program. We found the patient due to bleeding a lot and have a coagulopathy. So what can we do? And then we look at the data, what we have, trauma registry, and develop the protocol for massive blood transfusion protocol. So this is one can be used in all trauma center. Is actually we do it together. The nurses and doctors do it together to work it out. Without trauma nurse, it can't be done, okay? And then also we not only this, but also the others, okay? So the nurses can be also participate in research, transforming the information and the knowledge to the next generations. So the target, okay, for training and trauma nurse, just repeat, is that we need to improve the patient outcome and then make sure in all the aspects, we can know what's the problem in the system. We try to solve it, okay, to work together with the multidisciplinary team, and then use the quality improvement program and the guideline and whatever to make the practice be advanced, okay, and more suitable to meet the patient's needs. And then also we need to feedback if there anything not comply with a protocol or standard to the frontline staff, included our nursing staff and different specialty and all the system as well. So this is the end of my presentation. Hope you enjoy it, and I welcome questions. I think because I'm the chair of this session, so I also let me look at the questions. There's one question for me. Do you think if trauma nursing can consider to be fellowship level under Hong Kong Academy of Nursing in Hong Kong? Thank you very much for this question. This is really the target in the future we need to develop, because let's say without our well recognized level to be assessed or also have like fellowships, okay, we can't recognize some specialized nurses' achievement on that field. So, but the technical problem is that because the trauma care is a wide spectrum on different specialties, and the trauma volume is not very high. But however, is not high, not means it's not necessary. So I think it's good to be a future direction to develop the trauma nursing in fellowship levels. Thank you, Dr. Chen's questions.